In this recording, we are going to discuss vitamins. So we have, first of all, fat-soluble vitamins. There are 4 fat-soluble vitamins. We have A, D, E, and K. So let's start with vitamin A. Vitamin A is required for part of your vision. If you like being able to see in low light, or if you like being able to see in color, you can thank vitamin A. This is also used during normal growth and development as well. So where do we get this from? Leafy green vegetables, also yellow vegetables. Leafy green vegetables especially, that's going to be a recurring theme throughout these next few vitamins and minerals. So you're going to see that come up a lot. Now, what happens if we don't have enough vitamin A? We could have delayed growth, obviously. And you could also be considered night blind. If you have a really, really, really bad deficiency, you could potentially go totally blind as well. That's not super common in first world countries, but it is a possibility. And you could even have immune system dysfunction. Now, ironically, you can have too much vitamin A as well. This could cause liver damage. It could lead to osteoporosis, central nervous system dysfunction, and in extremely high doses, this could even kill you. I really don't think you ever probably would, but just in case, if you ever eat polar bear, don't eat the liver because it has so much vitamin A stored up that that is one of the few things that could lead to vitamin A toxicity and it could kill you. So just random fact, don't eat polar bear liver. There you go. Next, we have vitamin D. This is required for calcium ion homeostasis. So hopefully you remember that in order to absorb and utilize calcium properly, this does require vitamin D. It is also used for that bone growth directly related to the calcium as well. So a lot of times people think that, oh, maybe I'm not getting enough calcium in my diet, when it turns out maybe they're not getting enough vitamin D in their diet. Now, speaking of diet, where are we going to get this vitamin D from? Your skin actually helps synthesize vitamin D when we expose it to UV light. This is why it's recommended that when you are able to safely go outside and get a little sunshine. It really is good for you. And this is also supplemented in certain foods. For example, milk is one of the places that is regularly supplemented with vitamin D. Now, people can't have too little. We can have deficiencies in vitamin D. We see 2 conditions specifically related to vitamin D deficiencies. One is rickets, which is strictly seen in children. The other is osteoporosis, which is strictly seen in adults. These are really kind of very similar, almost the same thing. One, we just call it rickets when they're in kids, and the other one, osteoporosis in adults. But again, like they're very, very, very similar. And then excess. Okay, so you can have too much vitamin D as well. This could lead to multiple organ dysfunction. Again, that kind of goes along the lines of you would actually end up with too much calcium, and that could be bad for you. Now, vitamin E. Okay, this acts as an antioxidant. You've probably seen or heard that term on like a lot of commercials for different products. So anything that's considered an oxidant in your body, you might have heard like free radicals, things like that. Those are kind of doing damage on the cellular level. And so vitamin E kind of counterbalances those oxidants or those free radicals. And so it kind of helps prevent cellular damage. We can acquire vitamin D from vegetable oils, nuts, seeds, dairy, places like that. If you are deficient in vitamin E, this could lead to some types of anemia or certain central nervous system dysfunctions. An excess of vitamin E could lead to nausea, fatigue, or even vision problems. And then last but not least, for the fat-soluble vitamins, we've got vitamin K, which is required for proper blood clotting. Okay, so some of the factors involved in blood clotting require vitamin K. Another source, here's our leafy green vegetables coming back to visit us. Again, it won't be the last time we see that. And this one is actually also produced by the bacteria that live in your intestines, which is a little weird to think about. Everybody knows that they have bacteria in their body. Usually we associate that with a negative thing, but this time it's actually a good thing. They are producing vitamins for us. Now, if you suffer from vitamin K deficiency, you could have a bleeding disorder. Okay, so you wouldn't be able to clot properly. And if you have too much vitamin K, you could have a liver dysfunction, or you might actually clot too much. Okay, so this could be a problem for patients that are on blood thinners. Okay, so blood thinners are regulated pretty heavily. Patients that are on blood thinners have to have their blood checked very, very regularly to make sure that they're on just the perfect dose. Okay. Now, our water-soluble vitamins. Okay, so we have several water solubles. Most of them are different types of vitamin B, and then we also have vitamin C. So first of all, vitamin B1, also known as thiamine. This acts as a coenzyme in several catabolic pathways. So hopefully you remember an enzyme is a protein that speeds up chemical reactions. So a coenzyme is helping with that whole process. Okay. Dietary sources, legumes, whole grains, and even some meats. Deficiencies, there is a condition called beriberi, okay, which is not a typo. That's really what it's called. Beriberi is categorized by, excuse me, beriberi, you will see muscular weakness, you'll lose your coordination, you could have a fast heart rate, limbs can kind of go numb, things like that. You could end up also with heart disease, peripheral nerve disorders with the deficiency of thiamine as well. And then you could have an excess of thiamine, which could lead to a decreased blood pressure, and it could also cause nausea. There we go. All right, vitamin B2, that is known as riboflavin. Okay. Now, riboflavin is a critical component of FAD, which is used during the production of ATP. So hopefully you remember cellular respiration is that big complicated process by which we make most of our ATP. One of the components of that big process is a molecule called FAD. I can't remember what FAD stands for. I'm sorry. It's a big long word. You don't need to know it, but it is a part of that cycle. So if you don't make enough FAD, you don't make enough ATP. Everybody knows ATP is super important. It's our main energy source. So if you don't have enough riboflavin, you're not going to make as much ATP as you would like to. So dietary sources include dairy, eggs, some veggies, and sometimes it's added to a lot of grains to help us make sure we are not deficient. And if we do end up deficient, this could lead to skin disorders and dysfunction of your epithelial membranes. And then ironically, too much can also cause skin disorders. This could cause things like dry itching or dry skin, which would probably make you itch. Okay, B3 is also known as niacin. This one is a critical component of NAD. Okay, so not FAD, this one's NAD. Again, I don't remember what NAD stands for. It's a big old long thing. You don't need to know what it stands for. But this one is another component of cellular respiration. So this one plays a very similar role to the B2 in our bodies as far as making ATP goes. Some similar dietary sources. So we've got nuts, meats, grains, potatoes. And then deficiencies. All right, so we've got another deficiency. This one is called pellagra. Now, pellagra, you're going to have things going on like diarrhea, weakness, loss of appetite. You could even suffer from delusions or mental confusion. Okay, so you can see the central nervous system disorders, the GI disorders, skin dysfunction as well. Now, if we have too much B3 instead of too little, this could cause vasodilation, which causes skin flushing or burning. So so kind of think of what happens when you get really emotional or kind of embarrassed, your skin flushes and turns red. Kind of the same idea, but on a much bigger scale. In really, really extremely high doses of niacin, this could actually lead to death as well. So you're probably seeing some overall themes in here, kind of like Goldilocks. We don't want one extreme or the other. We don't want too little. We don't want too much. We just want that right amount. Okay, so there is no B4. We get to skip on over to B5, pantothenic acid. Okay, this is required to produce coenzyme A. You are probably more familiar with coenzyme A when we call it acetyl-CoA, okay, which again is part of the overall cellular respiration process of making ATP. Now, dietary sources, meats, grains, dairy, okay, and then deficiencies could lead to growth delay, central nervous system dysfunctions. And this one's a little different because there are no known causes, no known symptoms or problems associated with having too much vitamin B5. Okay, so we haven't really seen that one yet. Usually there's a problem if you have too much. We haven't really seen that in pantothenic acid. Okay, as far as we know, you can't have too much. All right, B6, pyridoxine. Okay, not peroxide, which I think is what I almost said. Coenzyme in multiple metabolic pathways. So again, that coenzyme working with enzymes in metabolic pathways. Remember, enzymes are helping these processes go faster. Okay. Dietary sources, again, meat, whole grains, citrus this time, and veggies. Okay. Deficiencies. Again, we're starting to kind of see a theme here. Central nervous system dysfunctions. This one also is associated with peripheral nerve dysfunction, could lead to anemia, could lead to growth delays. Now, excess, again, more central nervous system dysfunctions, including a coma, which also can possibly lead to death in extreme doses. So it gets a little fuzzy with some of these vitamins. You may have noticed a deficiency can cause central nervous system problems, but an excess can also cause central nervous system problems as well. I'm intentionally being a little vague here because I don't want any of you to get super bogged down in memorizing exactly which nervous system problems go with exactly which vitamins, and are we talking about deficiencies, or are we talking about excess, things like that. So I want you to be aware of these generally, but we don't want to get bogged down too much in exactly which ones or which problems are going with which vitamins. We're just trying to give a little broad overview here. Now, B7, biotin. Okay. Again, coenzyme in multiple anabolic pathways. Okay. Dietary sources, red meats, organ meat, which isn't always appealing to everybody. Eggs, I almost said legs. Please don't eat people's legs. Eggs, legumes, nuts, dairy products, things like that. Deficiencies lead to skin disorders, can also lead to neuromuscular disorders, can make you really tired. Again, just like B5, right now, we don't really know of any problems associated with excess biotin in our diets, which is kind of good. B9, folic acid, coenzyme in multiple metabolic pathways again. Leafy green vegetables here, fruits and grains as a source from our diet. Deficiencies can cause growth delay and anemia. And this last one is a big one, birth defects, especially obviously if you're deficient during a pregnancy. That one, put a star next to that one, underline that one, highlight that one. That one's a really, really big deal because the birth defects that we're talking about here can be really, really severe. The folic acid, like these problems are so bad that health agencies have started advertising and putting up billboards saying how important folic acid is during pregnancy. And all you really have to do to prevent this vitamin deficiency during pregnancy is just take your prenatal vitamins. Okay, so these birth defects, we're talking about like major neurological defects. So this can cause like spina bifida, neural tube defects, things like that. So that one's kind of a big deal. Now, excess, so you can't have too much folic acid. So we also don't want to overdo it, pregnancy or no pregnancy. These can mask the symptoms of vitamin B12 deficiency, which includes certain types of anemias. Speaking of B12, here we have arrived at good old vitamin B12. This is another coenzyme. This one is a coenzyme for nucleic acid metabolism. Okay, so when we break down things like DNA, RNA, ATP, things like that. And this is also required for erythrocyte production, so erythropoiesis. Okay, if we remember that big fancy keyword. So when we go to make red blood cells, we need vitamin B12. So where do we get it from? In our diets, we can get it from dairy products, meats, and it is also added to a lot of foods. Okay, usually they'll say that on the label if they've been added. Deficiency can lead to pernicious anemia. Okay, so remember your anemias are going to reduce your ability to transport oxygen throughout the body. And then excess leads to polycythemia. So that's too many red blood cells. So as you have probably caught on in A&P, too much of a good thing usually isn't a good thing. So too many red blood cells, yes, you could increase how much oxygen you can carry around, but if you end up with too many red blood cells, then your blood gets too thick, it's too viscous. It makes it hard to move through your blood vessels. It increases your peripheral resistance, which affects your cardiac output, things like that. So polycythemia isn't really a good thing. All right, and then we have vitamin C. Okay, so vitamin C is another antioxidant. Okay, so we talked about antioxidants with vitamin E. Vitamin C works in somewhat of a similar manner. Vitamin C is also a coenzyme in the production of collagen. Now, if you think all the way back, you got to think back to when we talked about tissues. Okay, when we talked about production of connective tissues, we talked a lot about collagen. Okay, we talked a lot about the places that you have a lot of collagen. So some of the layers of your skin, things like that. So if you don't have enough vitamin C, okay, you cannot properly produce enough collagen. Some of our dietary sources, the biggest one is citrus. Okay, also in red and green peppers. Okay. If you are deficient in vitamin C, okay, you may end up suffering from scurvy. Okay. Now, we don't see scurvy quite as much as we used to. People that used to go on the big long sea voyages back in the day. Okay, so people that traveled on ships, pirates, things like people like that. A lot of times they would come down with scurvy because they would run out of the citrus and the peppers. Okay, while they were on the boat. Scurvy, you will experience fatigue, loss of appetite. Your gums can start bleeding. Your teeth can start falling out. You bruise very easily. You'll eventually experience muscle weakness, things like that. So a lot of yucky things. And then overall deterioration of your skin, your other epithelial membranes. And then you can also have too much. Okay. Could also lead to nausea, vomiting, and then it could even lead to kidney stones. Okay. So that wraps it up on vitamins, both fat soluble and water soluble.